This video is proprietary to Therakos LLC and intended to be viewed in its full and current form. Therakos LLC does not permit viewers to use, reproduce, distribute, prepare derivative works, or display such video and content in any manner. Therakos LLC is not responsible for unauthorized use of this video and its content. The health status of the patient featured in this video reflects her opinions at the time the video was recorded. You're about to hear from a patient about her experience with skin symptoms of cutaneous T-cell lymphoma and treatment with Therakos photopheresis. This patient has been compensated by Therakos for their time in sharing their story. However, the views and opinions expressed by them are their own and do not necessarily reflect those of Therakos. Please remember that this is just her experience, and that every patient's experience may be unique. This information does not take the place of talking with your healthcare professional. It is recommended that you discuss the therapy and your conditions with your doctor. The following information is about the use of Uvadex, methoxylin sterile solution, with the Therakos Cellex photopheresis system for the treatment of skin conditions associated with cutaneous T-cell lymphoma, CTCL. In the United States, Uvadex methoxylin sterile solution is used with the Therakos Cellex photopheresis system for the treatment of skin problems associated with CTCL in patients who have not responded to other types of treatment given by their doctor. Select important safety information. Uvadex methoxylin sterile solution should only be used by doctors who have special skills in the diagnosis and treatment of CTCL, and who have received special training and have experience in the Therakos Cellex photopheresis system. Please carefully review and consider all the important safety information at the end of this video. Please click below for the full prescribing information, including the boxed warning for Uvadex. For more information on the Therakos photopheresis system, please speak to your doctor.
My name is Anita. I live in the Midwest. My partner Bob and I love to travel and go places in his RV. I have 4 children and 8 grandchildren, and my heart's always where they are. Some years ago, I developed a rash around my waistband of my pants, and it caused a lot of problems. I couldn't wear anything with a waistband. I couldn't wear jeans. I couldn't wear underwear. Anything that caused any friction on my skin would cause it to get red and flake off. It would feel very intense, like a sunburn would. And no matter what I did, it did not go away. People would notice it. They would go, "My goodness, what's wrong with your skin?" And so I tried to conceal it the best I could. I saw 2 dermatologists, an allergist. We did 3 biopsies. Finally, I got the diagnosis of mycosis fungoides, a form of cutaneous T-cell lymphoma, which meant that I have cancer. I was devastated when I got that diagnosis. I felt like my body had turned on me. I was really pretty angry. And then I realized that at least I could begin being proactive about my treatment. Because I'd been unresponsive to other treatments, my oncologist told me about a treatment option for my CTCL skin problems. It was called Therakos photopheresis therapy, also known as ECP. My oncologist and I went over the potential risks and benefits of the treatment, and understanding both was very important to me. Among other things, he told me that one of the side effects was being sensitive to sunlight for about 24 hours after the treatment. And so I should protect my skin and avoid direct and indirect sunlight for that period of time. And also wear wraparound UV blocking sunglasses. In addition, he suggested that I make an appointment and visit the photopheresis center near me, where I could learn more about the treatment and ask questions. And that's what I did. I went and met with the staff. I was able to ask questions, see the equipment, and actually visit with a patient who was getting a treatment. I know not every treatment center offers that, so I felt very lucky that I was able to do that. The nurses explained more about the possible side effects, including low blood pressure after the procedure, redness of the skin at the injection site, and possible fever within 8 hours of the procedure, and what to do if that occurs. The visit really helped take away some of the fear of the unknown about the procedure itself. I continue with my photopheresis treatment today, and overall my doctors and I were pleased with my treatment plan. Of course, everyone's treatment plan and experience is unique. All I can do is share my experience. I like that I can work this therapy into my everyday life. During the treatment, I'm able to connect to the internet and work from my laptop. Sometimes they have to kick me out of the room because my treatment's over and I'm still working. Today, I feel like CTCL does not have to define me. While CTCL is a serious disease and the skin symptoms that come with it are difficult to manage, I feel like I no longer have to think about it all the time. My advice to individuals living with CTCL skin symptoms would be to do research and be your own advocate. There are people out there in the CTCL community that may be able to help you, so I would encourage you to reach out. Ultimately, the best thing you can do is work with your doctor and find the right treatment for you.
The following information is about the use of Uvidex, methoxylin sterile solution, with the Therakos Cell-X photopheresis system for the treatment of skin conditions associated with cutaneous T-Cell Lymphoma, CTCL. It is recommended that you discuss the therapy and your conditions with your doctor. What is Uvidex methoxylin sterile solution? In the United States, Uvidex methoxylin sterile solution is used with the Therakos Cell-X photopheresis system for the treatment of skin problems associated with CTCL in patients who have not responded to other types of treatment given by their doctor. Important safety information. Uvidex methoxylin sterile solution should only be used by doctors who have special skills in the diagnosis and treatment of CTCL and who have received special training and have experience in the Therakos Cell-X photopheresis system. Do not use Uvidex if you are allergic to methoxylin, any product similar or related to it, such as Sorolin, or any of the other ingredients in Uvidex. You have a history of a light-sensitive condition or disease. You have had an eye lens removed. Use of Uvidex in this condition can increase the risk of retinal damage. Warnings. You may be at greater risk of sun sensitivity with Uvidex. Tell your doctor if you're taking other medications that cause sensitivity to sunlight, such as anthralin, coal tar or coal tar derivatives, griseofulvin, phenothiazines, nalidixic acid, halogenated salicylanilides, bacteriostatic soaps, sulfonamides, tetracyclines, thiazides, and certain organic staining dyes such as methylene blue, toluidine blue, rose bengal, and methyl orange. If you are pregnant or plan to become pregnant, tell your doctor. Methoxylin can harm your unborn baby. Tell your doctor right away if you become pregnant during your Uvidex treatment. If you're breastfeeding or plan to breastfeed, tell your doctor. It is not known if methoxylin passes into your breast milk. After Uvidex is given, exposure to sunlight and/or ultraviolet radiation may result in premature aging of your skin. Let your doctor know if you currently have skin cancer or if you had skin cancer in the past. If you're given too much Uvidex, you may get serious burns from UVA or sunlight, even through window glass. Avoid exposure to sunlight during the 24 hours after treatment. Exposure to UVA light when Uvidex is used can cause cataract formation if proper eye protection is not used. You must wear UVA light-absorbing wraparound sunglasses for the 24 hours after treatment with Uvidex when you're exposed to direct or indirect sunlight, whether you are outdoors or exposed through a window. If you're being treated for graft versus host disease, GVHD, Consult your physician for information regarding blood clots involving the lung and other parts of the body, which have been reported in these patients. The use of Uvadex for the treatment of GVHD is not approved by the FDA. Safety of Uvadex in children has not been shown. Side effects of Uvadex. Side effects of Uvadex used with Therakos photopheresis system are mainly related to low blood pressure. For the Therakos CellX photopheresis system procedure. What is the Therakos photopheresis system procedure? The Therakos CellX photopheresis system procedure is a medical procedure in which blood from a patient is collected into a specialized machine that separates the white blood cells from the other blood components. The other blood components are returned to the patient, and white blood cells are then treated with Uvadex, which makes them sensitive to ultraviolet light. The treated white blood cells are exposed to UVA irradiation inside the machine and then returned to the patient. This medical procedure is used to treat skin problems associated with CTCL in patients who have not been responsive to other forms of treatment given by their doctor. Do not undergo the Therakos photopheresis system procedure if you have a condition that makes you unable to tolerate loss of blood volume. You are allergic or hypersensitive to 8-methoxysorolin, methoxylin, or sorolin compounds. Your doctor has diagnosed you with a blood clotting or bleeding problem that can lead to either a blood clot or excessive bleeding. You have had your spleen removed. Warnings for the Therakos photopheresis system procedure. Treatments with Therakos photopheresis system should always be performed where standard medical emergency equipment is available. Therakos photopheresis system procedure should not be performed on the same day as procedures that can cause fluid changes, such as renal dialysis. Side effects of the Therakos photopheresis system procedure. Low blood pressure can occur with the Therakos photopheresis system procedure. You may get an infection and/or feel pain at the site of injection. Fevers of 100 to 102 degrees Fahrenheit, 37.7 to 38.9 degrees Celsius, have been seen in some patients within 6 to 8 hours after treatment. Redness of the skin may also occur with the fever. A decrease in red blood cells can occur if the Therakos photopheresis system procedure is given too frequently. Low levels of red blood cells may cause you to feel tired. These are not all of the possible side effects of the Therakos photopheresis system procedure. Tell your doctor about any side effects that bother you or that do not go away. Call your doctor or pharmacist for medical advice about side effects. You may report side effects to the FDA. Call 1-800-FDA-1088 or visit www.fda.gov/medwatch. You may also report side effects by calling Therakos LLC at 1-833-223-4ECP, 1-833-223-4327. Please see the full prescribing information, including the boxed warning for Uvadex, at www.therakos.com.